Hi everyone. So what we want to do in this video, and what we actually want to do a lot more going forward, is give you a deeper insight into the approach that we take at IKN. And in this video particularly, we wanted to start by giving you a more global insight into how we approach a client's movement system, if you like, and work towards restoring much more robust movement qualities, which for us are those qualities that should be expressed even in the face of uncertainty, even in the face of challenge and complexity, not just expressed in a very controlled clinical environment or clinical setting. Okay. And so one of the key concepts that we need to consider here is how the central nervous system offloads labor or offloads workload into our movement apparatus. And this is sometimes referred to as, in the research, as central mechanical flexibility. And so the central nervous system does this so that it doesn't have to control every individual component of our movement system during whole body movement. And the work of Nikolai Bernstein, the work of Michael Turvey, the work of Betty Tuller has really had a massive impact on our approach at IKN, because they've outlined some really important concepts that offer us an insight into how the central nervous system actually goes about doing this. And one of the concepts that you'll come across an awful lot of the time, if you look into their work, is the concept of a coordinative structure. And these coordinative structures, as you can see here, are self-organized, softly assembled set of components that can play different roles under different constraints, right? So essentially, what they are is they're ways in which the system organizes all the individual components, all the individual muscles, all the individual joint segments, and so on, in a manner that allows for sharing of load across a broader surface area, allows for cooperation throughout the system. And this is why you'll hear us talk an awful lot about taking a distal to proximal approach with our assessment and our treatments, because what these individuals have suggested, the Michael Turvey, Betty Tuller, Nikolai Bernstein, is that it's actually the environment that has shaped the unique architectural organization of our body. It's the environment that has shaped the organization of our movement apparatus as a whole. So we have, you can see here in the image, we have a lot of complexity throughout the midline. And as we move from proximal to distal into the longer bones of the limbs, looking at the humerus, the radius, the ulna, the femur, the tibia, and the fibula, those structures express less joint segmentation, less joint complexity. And then as we move even more distally into the hands and the feet, we have even more joint complexity. So if we're looking at things from a distal to proximal standpoint, we move from complexity to more simplicity to more complexity again. And this is just looking at on a joint level, right? And the thought is that this is the way it is because of the environment, because the environment is filled with such complexity, because the environment is filled with such uncertainty. Each portion of our anatomy, of our movement apparatus, needs to express a different behavior. It needs to express a different role to be able to handle stress, to handle forces acting on our body from distal to proximal, because it's usually the distal endpoints, the hands and the feet, that are directly interacting with the environment. And this is a key reason as to why we don't possess an awful lot of muscle mass distally at our limbs, around our hands and our feet, because muscle is very energy expensive, and having more tendinous, more elastic tissues distally allows us to be a little bit more responsive to stress. It allows us to be a little bit more responsive to perturbations acting on our system from distal to proximal. Okay. Now, this thought process allows for a different way to organize our assessment and a different way to organize our treatment, because it appreciates not just how the brain interacts with the anatomy, but how the brain and the anatomy interact with the environment. Because if we're only looking at it from a brain and anatomy standpoint, how the brain interacts with different portions of the anatomy, there's not really much context there. And we can say, oh, well, if someone's experiencing pain around the shoulder, for example, let's just find what's tight, let's stretch it, let's just find what's weak, let's strengthen it. But by appreciating the role of each region within the context of the environment, it gives us a different way to organize how we assess and how we load those tissues. So let's say if someone's experiencing pain around the shoulder, for example, of course there's lots of other contributing factors that we need to consider there as well. But and we're actually going to go through a very kind of general case insight at the end of this video as well, just to give you some context with what we're talking about here as well. But what we need to do in this shoulder case scenario is appreciate the role of the shoulder within the context of the entire coordinative structure. Is the shoulder, we have to ask ourselves, is the shoulder in direct contact with the environment? Not usually. The hand is. When we look at it from a upper midline or upper limb and upper midline coordinative structure standpoint, if we're looking at it from this distal proximal gradient of control from the hand all the way up into the head, it's the hand that typically directly interacts with the environment. So what if we've lost the capacity to handle stress, to handle load at these distal tissues, right? And now the shoulder is taking on a new role. The shoulder is taking on a role or behavior that the distal tissues should be expressing to handle load. And what this ultimately does is it potentially creates a disruption in the distribution of workload, a distribution of labor across this entire coordinative structure. And maybe perhaps an important component to consider when we're trying to restore adaptability around that shoulder. We might need to restore these distal capacities to be able to handle stress, to ultimately give these proximal tissues around the shoulder the opportunity to be a little bit more adaptable. Okay, so at IKN we feel there's a need to simplify how we organize the movement apparatus as a whole, and so we view it as three global body regions. So we have the midline, we have the upper limb, and then we have the lower limb. And each region generally will express a different behavior to be able to manage load from distal to proximal. In that the midline isn't typically going to express the same kind of role, the same kind of behavior as the limbs, because if they express the same kind of behavior, it's not going to be a very adaptable system. It's not going to be a system that has a broad scope of options to manage stress. And so what we've done at IKN is we've combined these three global body regions to form two coordinative structures, right? And this is only done as a framework to help us navigate the complexity of the body. Just because the movement system as a whole is extremely complex, there's lots of contributing factors, there's lots of influences on how we move. So we need a framework to guide how we assess and how we load a very complex system. So what we have here first is we have the upper limb and upper midline coordinative structure. And so looking at it from a distal to proximal standpoint, this coordinative structure represents the interaction. And we can even look at the interaction even more distally, the interaction between the environment with the hands and the wrist, with the lower arm or the forearm, with the upper arm to the scapula, into the rib cage, and then into the head and the neck. Right? And so with the lower limb, it will represent the interaction between you can say again, the environment with the foot and the ankle tissues, with the lower limb segment, the tibia and the fibula, up into the femur, up into the pelvis, up into the spine, and the rib cage as well. Now, the key thing when appreciating things through this sort of lens, from a distal to proximal standpoint, with looking at something like the midline, the midline then becomes not just a separate region, but it's actually a proximal extension of the limb, right? And so if we look at it as a proximal extension of the limb, we can understand the kind of behavior the midline needs to express to manage loads from distal to proximal. So the midline region will need to express a certain behavior to allow the system to maintain adaptability. And this is important because it will ultimately change how we load the midline, how we look at the midline in the context of the upper limb or the lower limb, for example, because the ultimate goal for us is to restore a much more robust coordinated structure and restore the capacity for distal to proximal load distribution. Okay. So moving on to the next slide. So the ultimate goal for us is to restore a much more robust coordinated structure where each interaction expresses a different role to handle and share stress, and to ultimately provide the system with a broader scope of options to manage stress and to handle stress. But what we also need to do here is appreciate the behavior of each local interaction within the coordinated structure on a couple of different levels or through a couple of different features, right? And how we categorize those here is we categorize them as neural features, muscular features, joint kinematic features, and attentional features. And we're actually going to record separate videos for each of these features as well. But what we're going to do here is we're going to start by looking at it from a neural standpoint, right? So when we're looking at how the nervous system interacts with the lower limb and lower midline coordinative structure, we need to consider things through a different lens. Not through a different lens, but we do need to consider things from a little bit of a different standpoint, because we're not looking at it from purely a muscular joint attentional standpoint. We're looking at it from a neural standpoint. So when we're thinking on a neural level, obviously this will intertwine with all the other layers as well. It will intertwine with muscular, joint kinematic, and attentional. But we can simplify things by creating a transition between conscious control and subconscious control dynamics, or conscious awareness and subconscious awareness. So within that coordinative structure, what local region might we want to bias more conscious control? So let's look at it from a lower limb, lower midline coordinative structure standpoint. Throughout the lower limb and lower midline, what local region throughout that coordinative structure might we want to bias more conscious control? And what local region might we want to bias more subconscious control? And what we need to appreciate here is that your system doesn't have a very large capacity to control things consciously. You have a very finite amount of conscious resources as a human, as an individual with a very complex system. Your nervous system doesn't have the capacity to consciously control each individual muscle, each individual joint angle across the lower limb and lower midline coordinative structure, as we're looking at it here. It doesn't have the capacity to do that consciously. So what it needs to do is it needs to be strategic with where it distributes that control. And what a lot of research shows us is that it's ultimately the distal segment that will guide what happens proximally. So the movement of the foot and the ankle, and how the foot and the ankle interacts with the environment will guide what happens through the proximal tissues. So when we're loading the system, the ultimate goal for us, and the sequence that we take to eventually get to this point will obviously differ, but the ultimate goal for us is to shift an individual's conscious awareness into the distal tissues to ultimately allow everything else proximally to take on more of a subconscious role. So if you look at it as a gradient, when we're looking at from distal to proximal, we go from more conscious to more subconscious. Because when we're moving, we don't want to be consciously thinking about the lower back of the hip, for example. And I'm sure we've all had those clients in front of us with lower back pain or hip pain, for example, and you can see in their movement that they're organizing their movements around the lower back and the hip. So they're thinking about what that local region is doing first, or to organize the whole movement around that local region, right? Consciously thinking about how that local region is moving. And we of course will need to look locally at that area, but we also need to consider how the distribution of conscious awareness around those proximal tissues through the low back and the hip may disrupt the behavior of the entire coordinative structure. How might consciously thinking about the proximal tissues around the lower back, around the hip, disrupt the capacity of the distal tissues to guide the movement of the lower limb and lower midline coordinative structure? If we appreciate this limited capacity for conscious control. Because if I distribute more conscious control through one area, it's going to limit my capacity to consciously control another area, or just shift more conscious awareness through that area. So for us, because the distal tissues of the foot and the ankle are in direct contact with the environment, we want those tissues to bias, not just conscious control where the brain's controlling everything around the foot, but we want the nervous system to bias a bit more conscious awareness into those distal tissues, because they're in direct contact with the environment, and allow for everything proximal to express more subconscious behavior. Okay, so let's look at this within the context of a very, very general case insight, just to give us more context with what we're actually speaking about here. So let's say we have a client with a gradual onset of left-sided low back pain. And of course, we need to appreciate many other contributing factors here as well. But this is really, this video here is really speaking about the interaction between the nervous system, the anatomy, and the environment, and how that will guide both our assessment and our treatment. So their pain is worse during activity, during and after activity, and better at rest. And they have a history of 3 ankle sprains. So let's consider what sort of sticks out in this client's subjective history without any objective tests just yet. So within the context of what we've just spoken about, if this individual's lower back pain is worse during activity, then for us this might potentially represent that the lower limb as a whole is not expressing the capacities to handle stress well from distal to proximal. And it's a case where potentially the proximal tissues are taking on that role. The proximal tissues are taking on the role of the distal tissues. The lower back, potentially the hip, depending on what the objective assessment shows, are potentially expressing more protective tone, more defensive behavior, you can say, because they're doing the job of the distal tissues, right? Because the proximal tissues don't express the same features of the foot and ankle to handle stress. The foot and ankle expresses a lot more tendinous tissue, more shorter fiber lengths throughout the foot and ankle tissues that help them respond faster to external forces isometrically. The foot and ankle expresses less muscle mass that's not as energetically expensive. So the proximal tissues, because they don't express these same local features, may express a lot more protective tone as a result. So this individual might feel worse or during activity and after activity, versus someone who might feel worse at rest, may have potentially some load sharing difficulty across these proximal tissues between the femur, the pelvis, the rib cage, and the spine. And so their tissues can't relax when they're trying to ultimately relax. So what we might theorize here is that the protective tone proximally is secondary to the lack of capacity of the distal tissues to handle and dampen stress well, right? And the history of ankle sprains may be a significant contributing factor that has led to this lack of capacity distally. So you can see the importance of not just viewing a local pain or local movement related issues or pain experiences within the context of local regions only, but we need to look at those in the context of the entire coordinative structure, right? So this individual is most likely distributing a lot of conscious awareness through the lower back on the left side. And so a big goal for us will be to ultimately distribute that conscious awareness more distally through a specific sequence. It's not a case where we're just going to dive straight into loading the foot and ankle, but it's about a sequence of loading that respects lots of other unique individual factors here as well. All right. So we might need to choose strategies based on other objective markers to try and restore a much more robust coordinative structure. So we may have to work proximally first here. We may have to work proximally to restore some sharing of load across the rib cage, across the spine, across the pelvis, and even to the proximal femur, right, through some dissociation strategies. But in this particular client's case, based solely on the subjective information here, there's lots of other things that we need to consider as well. We might be able to shift that load distally much sooner and try and work towards restoring the isometric capacities around the foot and the ankle tissues to ultimately give these tissues more proximally the opportunity to express more adaptability, right? Whereas someone who has maybe some true difficulties proximally, we may have to work around the proximal region for a little bit longer and work in a slower sequence towards restoring these distal capacities, right? So it's strictly client dependent and based on lots of other unique individual factors as well. So in the next few videos that we're going to post over the next few days, we're going to use this general case as the kind of the baseline, integrate some more specific objective markers to help sort of guide us through some potential loading strategies that we can use to restore the load sharing capacities across this coordinated structure. But we just wanted to share our general thought process with you first before we progress into those strategies. So thanks so much for listening to those of you that watched through the whole video, and looking forward to sharing more work with you over the next few days.